You've seen your GP for a medical problem and they've referred you to Homerton Hospital to see a surgeon. This short film aims to give you an understanding of what to expect as a patient coming in for surgery and going home the same day. This surgery could take place in either our day stay unit, as described in this film, or in the surgical centre. The process is the same for both units, apart from the location and timing, so please check your letter. Once your GP has referred you, you'll receive an appointment letter to come to one of our outpatients departments where our consultants hold their clinics. This may be at Homerton Hospital or maybe at another site, so check your letter carefully. It's important to contact us at this stage if you're unable to attend on the date and time stated on your letter, and we can rearrange it for you. If your appointment is at Homerton, on arrival at the main entrance, head towards the outpatients department and check in at the reception. They'll tell you where to wait for the doctor. While you're waiting, the nursing staff will take your blood pressure and other key measurements. Your hospital consultant will talk to you about your health problem, examine you and discuss with you possible treatments and any tests you'll need to have. It may be at this appointment or at a later appointment after further tests that the decision is made to go ahead with the surgery. Many surgical cases can now be done in a day and you can be home the same evening. Your consultant should be able to tell you at this appointment if this is the case for you. You then need to be seen in the pre-assessment clinic. You'll usually go there straight from your consultant appointment, or if not, you'll get a letter in the post.
You must attend this appointment to make sure you are fit and well enough to have your surgery. Our nurses and maybe an anesthetic doctor will ask you about your general health and any medications that you are taking and discuss the most suitable type of anesthetic for you. The nurse may do some tests. These may include your blood pressure, a blood test and a swab for common infections such as MRSA.
The nurses will let you know what to do to prepare. In most day cases, patients get a local anaesthetic which numbs the part of the body which is being operated on. Others will need a general anaesthetic and will sleep through their procedure. Let us know if you have any concerns about how you'll manage after your surgery. For example, if you feel you'll need support after you're discharged. Once you know you're having surgery, you need to start preparing. Get yourself as fit and healthy as possible. Check your blood pressure is normal, and if you have diabetes, check it's well controlled. In the lead up to your operation date, it's important that you eat and drink well and do some exercise. If you smoke, try and cut down. Stopping smoking for even a few days before your operation can significantly improve your healing afterwards. Speak to your GP, practice nurse, or the nurses in the pre-assessment clinic if you need advice on any of this.
Yeah, are you still okay to pick me up after my operation?
On the day before you come into hospital, confirm that you've got someone to collect you after your surgery. You'll need support from a responsible adult for 24 hours after you leave hospital. Please don't bring cases or bags full of clothing. You won't need them. Just the clothes you're wearing will do, but make sure these are loose-fitting in case you have any dressings after the operation. Well-fitting shoes that are easy to get on and off will help you walk around. Have a bath or shower, but don't shave near the area you're being operated on for up to 3 days beforehand. Remove any nail polish, false eyelashes and piercings, and don't bring any jewellery or valuables with you.
If you are having a general anesthetic, you need to be aware of when to stop eating and drinking to make sure the anaesthetist can get you to sleep safely. Eat normally on the day before your surgery, until 6 hours before the operation. That means you can eat until 2 a.m. for a morning admission. After this time, don't eat anything, and this includes milk and even chewing gum. The only thing you can have during this time of fasting is plain water, and that is until 2 hours before your surgery. It is good for your body not to starve for longer than is necessary, or it takes longer for you to recover.
Follow the advice you were given about which medications you should take before surgery. Make sure you bring your medications with you, or at least bring your most recent prescription list with the doses detailed on it. You'll find the day stay unit towards the right-hand side of the main hospital. Please arrive at 7:30 for morning surgery or 12:30 if your surgery is in the afternoon. After you've booked in at reception, a nurse will come and meet you to take you into the unit. For patients who are being put to sleep for their operation, your friends or relatives will be asked to wait for a phone call instructing them to collect you with a private car or taxi once you're safe to go home. We're unable to give or predict the exact time that you'll be ready to go home, however, we will do our best to get you home as soon as possible. Please use the hand sanitizer to clean your hands before entering the department. Put your mobile phone on silent and please don't take photos in the interest of other patients' privacy and confidentiality. The nurse will show you to your private cubicle where you'll be asked to undress into a theatre gown and disposable underwear. There are specific male and female areas in the unit. Your identification and date of birth will be verified and checked against your medical records. You will then be fitted with an identification band. The nurse who's carrying out your admission assessment will ask you a list of questions to complete your surgical safety checklist, such as when was the last time you ate or drank. Please be honest with your answers for your own safety. Some women will be asked to provide a urine sample. This is for a routine pregnancy test. The anaesthetist will come and see you to ask some questions about your health and to do a safety assessment to establish whether you're fit and well enough to proceed with your operation. You'll be reviewed by your surgical team who will explain the procedure planned for you, check that you agree and consent for your procedure to be done. We have separate rest areas for women and men where you can relax while waiting. There are normally several operations going on during a morning or afternoon session, so you may have to wait a while to go into the theatre. When it's time, you'll be taken through to the operating theatres. If you're being put to sleep, you'll be given some oxygen through a face mask and will have a cannula which enables us to give you medication. We'll remove this as soon as possible after your surgery. Your anaesthetist will then administer the relevant anaesthetic. After a general anaesthetic, you'll go to a room called recovery where you'll wake up. You may feel sore or drowsy. You must tell the recovery nurse if you're feeling any pain or sickness so they can help you to feel more comfortable. Once the recovery nurse is satisfied that you're ready, or if you've had a local anaesthetic, you'll be taken to the step-down area where you'll be transferred to a recliner chair and handed over to your nurse. You will have further observation checks and monitoring, such as checking your blood pressure, pulse and temperature. You'll be encouraged to eat, drink plenty of fluids to rehydrate, walk and pass urine as soon as you can. Once the nurse is satisfied that you're safe for discharge, your escort will be contacted with instructions to collect you. You may be reviewed by the surgeon or anaesthetist if required before you go home. Before you leave the day stay unit, the nurse will explain your discharge summary document to you and give you all the necessary instructions, such as information on wound care, medications, practice nurse and GP information, and follow-up appointments. You may also be given an information leaflet about what to expect and what to do and not to do following your procedure. Please follow these instructions carefully. Once your escort has arrived, the nurse will take you to the reception area and you will be able to go home. If you have any problems once back at home, either contact us, your GP, or if it's an emergency or out of working hours, please go to A&E. We would like your thoughts on anything we did well or could do better. Before you leave the ward, you should be asked to fill out a survey, and after you've gone home, you can contact our PALS department to give any feedback.